Okay. Good afternoon, everybody. Here today. All right, maybe. All right, we're live. Good afternoon. Facebook Live. We're doing our Great Start Collaborative Community Connections this morning. And this is Jean Favor. I'm a family liaison with the Great Start Collaborative and Family Coalition of Charlevoix, Emmett, and Northern Antrim County. And I'm super excited to have Savannah with me today. Savannah and I know each other very well because she is the director of the Great Star Collaborative of Charlevoix, Emmett, and Northern Antrim counties, and we work together very closely. So she is not here in that role, in that capacity today. However, she's here to talk to us about doulas. And so we've had a lot going on. If you follow our Facebook and our newsletters, we've had a lot going on with doulas, and it's such a great resource out there that I think maybe people need to know more about. And so Savannah is here to tell us all about that. She's had a leading role in working with the Doula initiative. I don't know if that's what we call it in our area. And
You
she's
do.
gonna, she's gonna answer all our questions today. So if you're here live and you're in the chat, Caitlin is. Good morning, Caitlin. We have a doula in the chat with us. So if you have questions about doula, even if you are a doula, put them in there. Or if you have information you'd like to share, feel free to pop that in the chat as well, and we will cover that and share that out with everybody else. So without more ado, welcome Savannah, and maybe you want to give us just a brief intro of you. I know you have some personal experience with doulas, which maybe you can relate to everybody, and then maybe just kind of tell us what a doula is, what they do, and who might want to look into doulas.
Yeah, thanks, Jean. I'm thankful for the opportunity to share more about doulas in our community. I'm Savannah Cool. I'm the director for the Great Start Collaborative. And in the last year, we've really put a lot of eggs in the basket for doula work in our community. One of our outcomes for the GSE is children are born healthy. And in January of last year, Michigan Medicaid made a change to policy, which was allowing doula services to be covered for all Michigan Medicaid recipients at no out-of-pocket cost as preventative health care. We were very excited about that for our
I
community
feel
and our
like we need to
families.
say that like a couple extra times because that's a big deal. Like that, like we say it and we're kind of used to it, but that's a big deal. So if you use Medicaid for health insurance, you can access doula services, and we'll get into what a doula is, right?
Yep.
It's part of your care, which hadn't been previously. So awesome, and soak that in, everybody, and look into that a little bit more. Okay, sorry.
You're okay. So we're really excited about the opportunity for everyone, and we knew we had a couple really fantastic doulas in our community. However, there were not enough doulas in our community to actually serve like the number of people that we're now going to be able to access these services. We really wanted to take some time and energy to think about how we could actually create a change in our community, because while the statewide change was fantastic, if we didn't have more doulas, people in our community would not be able to access. We started the Right Start Collaborative Doula Initiative in Charlevoix, Emmett, and Northern Antrim, and it just kind of spiraled from there. A doula is a trained professional who provides continuous physical, emotional, and informational support to individuals prenatally and through the perinatal period. Leading up to pregnancy, in the early stages of pregnancy, during labor and delivery, and then also postpartum. It's not doulas are not medical professionals. They're not there to be your medical provider or to offer medical support or care. They're simply there like a coach to support you in your advocacy efforts, to help you achieve the birth experience and the pregnancy and postpartum experience that you really would like to have for yourself and your family, and to help you make the best decisions along the way. So if you have questions about specific things, they can help you find evidence-based information so that you feel capable of making the best decision for yourself, your family, and your baby who's growing and going to be here soon.
Awesome. So you said that they're not medical professionals, but so do they work with? So let's say I have a doctor that I work with. So would my doula kind of work with them, or do I? It's not a separate thing. Does it all work together as a whole? What does that look like?
Yeah, so one of the most amazing parts of having a doula, a lot of our medical practices and kind of the hospitals that serve in our community, you don't always get to pick who your OBGYN or it is and who's going to be at your birth. But you do get to pick your doula. So that's the beautiful thing. You get to choose who your doula is. You get to hire them on your own. and they can support you from the very beginning and be there at your labor and delivery and support you in postpartum. And while they do certainly work as a member of your birth team or your perinatal team, they don't work for the medical profession or for the doctor's office or the hospital. They work for you. And so their job is to make sure that they're serving your needs and your wishes. And they certainly work really hard to partner with all of your other members of your birth team, as we would like them to, and as you would like them to. But their primary responsibility is to help you achieve what you want.
Awesome. So, yeah, you mentioned advocacy, and I know a lot of birthing people are really, you have an idea about what you want this process to look like before, during, and after. And so there's a person there to support you with that that's trained and has experience and can really kind of guide what that might look like for you. So that's really great. So
Yeah.
that's one way. What are some other things that doulas might do for you? And I think so, like Medicaid, and you can correct me because I'm not. You can have a certain number of prenatal visits, birth, and postnatal.
Yep.
Postnatal.
So, doulas will provide services to anyone. So you don't have to have Medicaid. You can hire a doula on your own and see if your private insurance will cover it. You can cover it out of pocket on your own, or you can use Medicaid services to cover if you have Medicaid and the doula accepts that Medicaid contract. However, if you have Medicaid, that preventative health care that's pre-approved is up to 3 prenatal visits, attendance at labor and delivery, and then up to 3 postpartum visits that would be
Awesome.
covered by Medicaid.
Awesome. So, depending on your insurance, maybe more or less, or what you'd like to pay for, more or less, getting those that filled in. So, okay, so maybe I found out that I'm pregnant. I'm working through that. Maybe I'm working with a doctor, but I'm interested in having a doula, and I don't really know what these visits would look like, why I might use it. So, what would I expect to happen at maybe my prenatal visit with a doula?
Sure. I think one of the most unique things, and if you're not familiar with doula services, you might not know this, but doulas come to you. You don't have to go to them. So it's not an office that you're going to meet with them. They're going to come to you either in a community setting that's mutually agreeable or to your home. And you really get to start building rapport with them. So one of the first things they're going to do is just kind of get to know you and ask you about like what are your interests for your perinatal experience? What are you hoping to achieve? They'll certainly ask you some background information about, have you had any other pregnancies or births along the way, how your medical experience has been going this far if you're already connected, so they're aware of like any challenges that you might be facing. They're going to dive in on fears with you at some point. So that might not be your first prenatal visit, but they're really there to support you and make sure that you have everything you need. So their primary kind of responsibility is to do a lot of listening and then support based on what they're hearing for what you're trying to achieve and maybe help you reduce any fears or
Mm-hmm.
anxieties or gather resources for areas that you're interested. And then a lot of times, an individual and a family will want to actually establish like a birth plan with the doula, which really helps somebody in a family kind of lay out on paper in a really clear way what you want your experience to be like, what like the yeses are and the no's
Mm-hmm.
are of like, no, I don't want that to happen. A lot of times doulas closer to time of like expected arrival will have a conversation with families about, this is the experience that you do want and this is the way that we want it to go. But what if it doesn't end up that way? Like, what if there's something unexpected that we didn't want to happen? How should we handle that? How would you like to approach that? So that you're prepared for all the outcomes that could possibly happen and to try to make the experience the best possible, no matter what that looks like.
Okay, sounds really in depth and a lot of prep work for the actual birth.
Yeah.
So then what?
There's lots of education, right? Like lots of education. And so we do have some doulas in our community who are also childbirth educators, which is really fantastic, but not all of them are. However, they all come with like some education and resources to share in that vein as well.
Yes, wonderful. And I imagine when you're, just like anybody else, you're interviewing your doula, you can ask them what needs you're looking for and what. And I know that we have this fabulous community, so I know that we have doulas of like that's not, you might be wanting to talk to this person. So we have a great
Yeah.
system kind of set up to make sure that your needs will be met, and you'll find just the right fit for you in our community. So
Yeah,
so
so we, in May of last year, as part of the GSC Doula initiative, we brought a training to our community from Dona International, and we trained 23 birth doulas who are now available throughout our community. And then in October of last year, we did a postpartum doula training and trained 20 people in postpartum work. But rather recently, since then, we created the Meet the Doulas Guide, which is available on our website. So if you're not familiar with doulas, it's a really fantastic way to gather a little bit more information. But certainly, if you're interested in getting a doula in support, it's a great way to look at a document and kind of look through. It's a nice little introduction to the different doulas in our community, shares a little bit about what insurances they work with, if that's something that is important to you, and kind of tells you about them, right? Because everybody has their secret sauce. Like you can all have the same job or the same role, but personalities, styles, expertise is different. And so we always encourage people to interview multiple people for their medical care, right? So that you feel comfortable. And while doulas are not medical professionals, the experience is similar. So we would also encourage people interview multiple doulas and find the one that feels right to you and your family and your support system so that you just have a really great system along the way.
Perfect. So we find a doula. We've got some prenatal visits, and what I know we'll making our birth plan, so that'll look like what our birthing day looks like. But what are some things that I might expect my doula to be doing at my birth? Are they just are they also there just advocating and like keep going, you got this, or what does it feel like and look like to have a doula at your birth?
Yeah, so most of the time, a doula is going to be there for your labor experience. So they're there before you're in the hospital typically. Like you're calling them and saying, I'm in active labor and I need some help, or I just want an extra pair of hands, or I need a pep talk, or, you know, labor and delivery is not the most comfortable experience for a lot of people. And one of the primary roles of a doula is to help with like physical comfort and emotional support. And so they've been trained in a lot of ways and tactics to provide comfort measures. And they can teach that to your partner or the rest of your support team. So if you have a partner who's not been through labor experience before and is a little unsure, they can kind of get them engaged and show them how to help support your comfort during that period of time. And then they can also help you make decisions about maybe it's time we should go to the hospital now. Or sometimes people have other children in the home, and so a doula can help with the other child too, like they're waiting for another caregiver to get there or whatever. It's really just about creating a family experience and the experience that's needed along the way. And
Yeah.
then once individual is in a hospital, the doula will go along with you, as long as you choose for them to. And they support you there as a member of your birth team in the hospital setting as well. Sometimes if like a C-section is the scenario, not all hospitals will allow a doula in the operating room, but some will. And as long as they will, your doula will go with you there too and support you through that. And they're certainly there after baby arrives to support you in until you get that first latch and feel comfortable, until you kind of have things calmed down and make sure you're kind of like, okay, like I got through
Got
this
this.
and it's gonna be okay.
Awesome. But then they're not
Yeah.
necessarily done then either. So you're done.
No,
And they might not be
no,
done, or they may be.
yeah, that's the most beautiful part of having a doula is they get to support you like way before baby comes through that whole process of like getting ready for labor and delivery, and they support you at labor and delivery, and then they get to come back. And so there's somebody who follows you the whole way, where most of your nurses and your medical providers are kind of like gone or you're transitioning to the next one. That doula gets to come and support you in the postpartum period. So they can come and help around the house with things. They can, their primary role is to support mom in taking care of herself, or
Hmm.
the birthing person to take care of themselves so that they can take care of their baby. And so it's like, hey, have you drank water? Did you eat breakfast today? Or do you need lunch? Like, do you need to take a shower? Do you just need somebody to talk to? Here I am. And then a lot of times, like, first time parents will have those questions that you just don't know about, right? Like,
Hmm.
um, that's diapering thing's not working the way I thought.
Hmm.
Or, I don't know, does it look like they have the right latch? Or am I doing this right? Or how warm is that bottle supposed to be? Or, how long can the bottle sit out before I'm not supposed to use it anymore. And anyone who's had the postpartum doula training has received training in all of those things, and they're prepared to support families in that and just make the experience a little less stressful and mostly provide reassurance, right? Like, no, you've got this and you're doing the right thing. Or, yeah, maybe that's not working, but let's try this approach instead. Maybe this will work.
I just like, can we just have like daily life doulas? Because I feel like somebody walking around and be like, have you taken a shower yet? Would benefit a lot of us. Drink your water. So, yeah, and then that really
Yeah,
sensitive postnatal, post birthing period, like it can be a wild ride. So, having that person that knows you and has been through the process and can support you, and like you said, also train the people around you, like ways that they can be there. That sounds really invaluable. And I know I've said this to all the people that I talked about doulas to. Like, I didn't know I've heard the word doula, when I started thinking about having babies, and no idea what that meant. It was a little scary. Like, what does that mean? Is that a doctor? Is it something? And so I wish that I'd had that experience of having somebody kind of explain it to me. This is just a person who knows a whole lot of stuff and really cares about your well being. So they're
yeah,
going to be there for you. And that's what that's kind of in a nutshell. Because I would have jumped on that, you
yeah.
know.
I think the most unique part is that a doula really is like their person, right?
Mm-hmm.
Whoever the person is that's pregnant, like they're your person. They're there for you. Like
Mm-hmm.
you are their primary responsibility and their primary interest. And um, yeah, it's not about like, I just want to hold the baby. It's like, no,
Right.
like I'm really here for you. Like, what do you need? Like, I'm holding you. I'm
Right.
taking care of you.
Do
I'm
you need
making
me
sure
to
that
hold
your
the
needs are
baby?
met.
Yeah.
Yeah. Like they still might want to hold the baby, but
Right, right. Yeah, I'll do that if you need some help. Yeah, that
yeah.
sounds great. And so you mentioned the Meet the Doulas guide. I'm checking, we don't have any questions in there. So that's, how do I find a doula, right? So one way is, right, Google search, but the Meet the Doulas guide on the greatstartcollaborative.org website is a really great resource, and it's kept up so that you can read about each doula pre-interview. Kind of says, I think it says which insurances they currently accept and kind of their philosophy and their experience, their history. So it's a really beautiful guide to check out, and we can pop that in the chat as well. But what else do we need to know about how to find them and what to do?
Yeah, I think one of the other really important things to say is that to have a doula, you don't have to do all the things that we talked about, right? Like if you're somebody who's not super comfortable with like another person being at your labor and your birth, you can choose to just have a doula during the prenatal period, where it's like I just want somebody to support me
Right.
and like helping me understand what's going on with my body and the things and the feelings that I'm having, like leading up to labor and delivery. They can offer just prenatal support if that's what you want. It's not a like whole thing or nothing.
Mm-hmm.
Also, if you're doing like 2 weeks and you're just hearing about what a doula is and you're like, oh my gosh, I've never connected one, but that would be really amazing. Like, that's okay too. Like, you can start reaching out to people, and if somebody's willing and able to like take you on, they can start supporting you during the labor and delivery process too. So you don't have to have been with them for a long time
Yeah.
before. And similarly, if like you have baby and then you're like, oh my gosh, I didn't realize that I didn't have as much support as I thought, or this is much more difficult than I thought, or I
Mm-hmm.
just need an extra pair of
Right.
hands. It's totally okay to just have a doula for postpartum support as well. And so, like, it's never too late to reach out, type of thing, as long as you're in that perinatal period of time. You get to be the driver and decide what your experience looks like and what you want and don't want. And we certainly talked about a lot of things today that a doula could be, but I think the most important thing to say is that the options are kind of endless. A
Mm-hmm.
doula can do just about anything to support someone that's not medical, based on what your wishes are and your wants are and your needs are. So there are doulas who specialize in different areas. There's bereavement doulas. So if you're finding out that maybe your pregnancy isn't the way that you wanted it to be and you're looking at loss or whatever, there are doulas that specialize in that can support you through that. Even when that's not known in advance, many of the doulas are trained in bereavement type care and support so that if that's an unknown scenario that comes up, they can support you. There are adoption doulas as well that can specialize. So if someone is not pregnant themselves, but they're pursuing a family through adoption, they can hire an adoption doula to support themselves and the birth mother or the birth parent in this scenario if they want to. Um, there's just a lot of different like specialties and supports along the way that are available. So, um, and then lots of add-on components of training too. So we try to kind of detail that in our Meet the Doulas guide as well. Like I said, we have a couple doulas in our area who are also childbirth educators, so they kind of bring that special sauce. We've got others that are body workers that bring that to the
Mm.
table as well. We have a couple that are working on some breastfeeding and lactation support specialties that bring that to the table. So everybody has something just a little bit different. And I kind of feel like there's a doula for everybody. If you just kind of like look a little bit, you're gonna be like, oh, that's my doula.
Yep, yep, that sounds perfect. Yeah, that's awesome. So definitely recommending checking out that guide to anybody. And when you say, I think you mentioned, as long as you're in the perinatal period, which is before, during, and after birth, is there a, so if you're the person that's like, I've had a baby for this many months and I need help, how long, like when am I out of that period that I'd be looking for maybe a
Yeah,
different
I mean,
sort of
I don't think
support?
there's a hard answer to that. Most of the time, when you talk about doula services, it's usually through like the 6 month period of time. But there are a lot of families who, if they have the resources and the ability, they might keep a doula on longer to offer what a lot of people used to refer to as like night nurses
Mm.
or whatever. Doulas can fill those roles too and are really well suited for those types of things. So like I said, the possibilities are pretty much endless based on what somebody is looking for, their family is looking for, and their resources to support that.
Beautiful. Yeah,
Yeah.
that's a lot of information and wonderful information to have. So before we sign off, I don't have any questions for us in the chat. Thank you for everybody who's checking this out. We're glad to have you here. Um, any last parting thoughts before we sign off?
I
We,
don't think
we
so. I know
covered
that
a
was a
lot.
lot of
It's a
information.
lot.
And I would just encourage folks, like if you are planning to become pregnant or you're currently in the perinatal period, certainly check out the Meet the Doulas guide, see if it's for you, and reach out to some of our doulas because they've done a lot of work to gain the education and skills and experience to support you, and they're ready to help you make the best possible experience for you and your family.
Excellent. Thank you, and thank you for all the work in the doulas, and thank on the doula initiative, and thank you doulas in the our guests here today for doing all you do as well for families. So we'll sign off, and if you have further questions, check out our website, greatstartcollaborative.org. Go to, I think, Family Resources, and Meet the Doulas Guide is in there. There's also a link from the home page. And our Facebook, has all sorts of ways to contact us and reach out if you have more questions. We'd love to hear from you and answer those. So thank you, Savannah, for taking time today to kind of fill us in on the doulas, and we'll see everybody on the next time.
Bye.
Goodbye.